All right. So our second speaker is Dr. Chris Smith. And Dr. Chris Smith will talk to us about the basic immobilization principles for wild ruminants. That's from an impala, kudu, nyara, to a buffalo. Yeah. A little bit about Dr. Chris Smith. Dr. Chris Smith is not just a wildlife vet, but someone who has played a big role when it comes to wildlife conservation in Malawi. He was part of the vets that reintroduced wild dogs and cheetahs to Malawi. And Dr. Chris is also very passionate about equipping veterinary students with the knowledge that they need to become wildlife specialists that Africa needs. Thank you so much, Dr. Chris, and we're so happy to have you today as our speaker. And before I hand over the screen to you, I just would like to go through the learning outcomes. So by the end of this talk, you should be able to understand how to analyze and troubleshoot darting failures and understand initial capture field considerations. Secondly, you should be able to determine appropriate drug choice and dosage based on species size, healthy, and desired anesthetic plan. Number three, you should be able to understand the implementation for both physical and instrumental monitoring techniques for anesthetized ruminant. Lastly, you should be able to know how you can prevent complications by using proper animal positioning and managing species-specific risks. Thank you so much. Now I'm going to hand over to Dr. Chris Smith. Dr. Chris, the screen is now yours.
All right, good morning, everyone. Thank you very much, Stella. I appreciate the very kind welcome. Yeah, and I think thank you, Dr. Corin, for the lecture as well. I think both of us, whilst we're working with wildlife, you're going to see some very different approaches to our various patients. We obviously work largely out in the field, and so it does make things like monitoring a lot more challenging. And obviously just where we are, just in very rural areas, it's obviously gets very difficult to get our equipment in and things like that. So I think though, just if I can say quickly about Dr. Corin, when it comes to, let's say, the small and medium mammals, there's honestly no one to learn from. So I think when it comes to the birds and the pangolins and things like that, there was no one better to give that lecture. So thank you, Dr. Corin. Okay. Okay, so the first discussion that we're going to have is going to be on the ruminants. Okay, so initially it was going to be the small ruminants, but we've kind of improved or increased it to kind of all the ruminants. You'll see there and equids. I've taken the zebras out just for now. Obviously they're not ruminants, and yeah, so we're just going to focus predominantly on the ruminant species for now. The important thing to remember is whilst there are many different kinds of ruminants, things, giraffe are even classified in the ruminant species, all the way down to small antelope like dacre and things. It's a very broad classification, and a lot of these antelope species and a lot of these ruminants react very differently to the mobilizations that we use. I'll specifically use the word immobilization there compared to what Dr. Corin was talking about with some of the birds using a general anesthetic with gas and things. It's very important to remember that these are only immobilizations. So essentially, it would be unethical to try and perform any major surgery or anything like that on the wildlife that we'd be working on in the field. It's merely an immobilization. If you're needing to do longer procedures, that's a whole nother discussion. This is very much more focused on from a capture relocation point of view. So quick immobilizations and quick procedures, collaring, snare removals, but you wouldn't do any kind of invasive surgery on this protocol that we're going to be speaking about today. Again, like we said, there's a huge variety of responses that we get to the drugs that we use. So just as a complete example, an antelope like impala are incredibly sensitive to potent opioids. And so that needs to be monitored very, very carefully. But then you've got some of your bovids like buffalo, very, very tolerant and can actually tolerate quite high volumes of these drugs. Then there's obviously a group of antelope, which I think fascinates everyone, which we call the spiral horns or the triglyphids. And that's things like your kudu and your nyala, bushbuck, eland. And they need a lot of medication to actually become immobilized, that they are then handleable to be able to work with. So like I say, we're doing this under ruminants. Just as a side note, when on a lot of the courses I do, we actually do all of these ruminants and things over about a 2-week period, and I've been given 35 minutes to try and get through as much as I can. So please don't. There's going to be a lot that we don't get to touch on. I'm not even going to look at, let's say, the treatments from a veterinary point of view. This is very much focused on anesthesia and basic monitoring of these species. Okay. This isn't an anatomy lecture either. This image that I've put up here, it's the kind of take-home message that I just want to get across with some of these antelope, particularly the smaller one, is how much bone density there is when you're trying to take your shot to dart these animals. The biggest issue that we obviously have, which we'll touch on later, is with the incorrect selection of your equipment, whether it's something like the dart or dart gun. You're actually very prone to causing more harm to these animals by a misplaced dart that could break a bone, penetrate the thoracic cavity, penetrate the heart. We've had that before. And so you just need to understand that some of these ruminants, particularly the smaller ones, are actually quite fragile and sensitive species to work with. Just some general capture considerations with majority of the ruminants. As you know, most of them fall under prey species. Okay, so that obviously means that things like lions and leopards, wild dogs, cheetah, they obviously prey on these animals, which means that most of these species will show a flight response. Okay, so that means obviously if we're trying to dart them and we approach them, let's say on foot or something, you'll see that they will generally actually just try and run away. Obviously, that's not true for all species. Some of the bigger ruminants, such as buffalo and even blue wildebeest, they can actually be quite aggressive and actually come for you and not run away. So I would say when working with the larger wildlife, the kind of your anesthetic knowledge might be 10% or 10 to 20% of a procedure. The rest is going to be on knowledge of the species itself, how they're going to react, the terrain that you're working in, the equipment you have. There's a lot to capturing these larger animals. Okay. If you are looking at trying to catch a large group of these ruminants, things like impala or kudu, to dart individually 1,000 is not really that practical. So there is mass capture as an option, which we're not going to obviously discuss today. That's another whole discussion. But the kind of these immobilizations are more focused on if you need to, like we said earlier, a quick procedure such as collaring an animal, removing a snare, or capturing it that needs to be relocated. Okay, where there's no major treatment involved. Okay, like I showed you in that previous picture of the impala with the structure, there's a lot of selections that need to be done beforehand. Okay, and decisions that need to be made. And from the veterinary point of view, and as the veterinarian who will be darting these animals, the biggest things when selecting your dart is obviously going to be the dart size and the needle length. The goal is always to have the smallest dart with the smallest needle appropriate. Okay. But for some of the larger ruminants, let's say like a buffalo, if you use a very, very small dart, let's say that would be effective for impala, that needle won't even penetrate the skin on something like a buffalo. So you need to take these things into account. Okay. Then I made a very big note there at the bottom. Positioning is very important. Okay, and we'll touch on that now. Okay, so this is obviously the positioning or the posture of these ruminants. Okay, so the biggest issue that we see, they are very prone to bloating whilst they're under the immobilization drugs. Okay, This can lead to respiratory complications if not addressed. Okay, so obviously one, just, as that rumen bloats, it starts pushing up against the diaphragm, and that animal's actually not able to expand its thorax as much as it should. But the biggest complication that we see is what we say regurgitating, and then that animal aspirating, and this is fatal in most instances. You might not always see it straight away. Obviously, if it's a significant amount of fluid, that animal will die pretty quickly. But if it's a small amount, you can actually get a septic pneumonia that sets in within about a day or so, and a couple of days, those animals end up dying. Okay, so the golden standard when we're working with ruminants is always to have the ruminants internal recumbency, with their necks up and the nose pointed down with their tongue out. So you can see with the Nyala in the bottom picture there, that's the exact kind of positional posture that we want these animals in. Okay, obviously when they like this, if there is regurgitation, all that content will actually then just come out of the mouth and onto the ground rather than being inhaled. Okay, but if you do start seeing signs of regurgitation, it's better actually to antagonize the drugs and wake that animal up as quick as you can to avoid any further complications. Okay, so when you're deciding on your immobilization and your choice of anesthetic, there's obviously quite a lot that you need to take into account beforehand. So obviously the species. Okay, so are you working with a buffalo? Are you working with a giraffe? Are you working with impala or a dacre? The size of the animal is obviously what we're trying to aim for there. So that will obviously, like we said earlier, help with the dart size selection. Obviously the age is very important. Okay, kind of your very, very old animals, some of them are actually slightly poorer health and so may actually need less drugs to become immobilized. Likewise, with very young and small animals, they'll also need less immobilization drugs. Okay, then the gender of the animal is also very important. Generally speaking, the most important one are your pregnant animals. Okay, so thankfully with a lot of the ruminants, they're fairly seasonal breeders. So let's say at the moment, working with a lot of impalas at this time of year, you're going to know that you're going to need a little bit more anesthetic, as they're quite heavily pregnant at the moment, compared to, let's say, in May, when they are either dry or very early pregnant. Okay, condition of the animals is very, very important. A lot of your reserves and clients might call you to come and assess a sickly looking animal. Obviously, giving them a full dose of immobilization drug might actually be fatal. These drugs that we work with are incredibly dangerous, particularly the potent opioids and the alpha-2 agonists. And obviously time of year. Okay, again, this time of year, obviously we're right at the end of the dry season here in Africa, or in the southern hemisphere of Africa, should I say. And so most of our ruminant species are actually quite poor condition. So take that into account when making your selection. Then the overall health status, obviously, of the animal. Is it injured in any way? That all needs to be taken into account. The required downtime. Okay, so obviously with our various different protocols, which we only have very little time to touch on today, but there's some drug protocols which have a very quick induction time. Some are slightly longer. If you are working in a nice flat area, it doesn't really matter about your downtime. But if you're in a, let's say, for the guys in Malawi, like a place like Luwandi and Majeti, where there's a lot of water and it's very thick, you actually want those animals to get down rather quick, so you can get your hands back onto them. Okay, and then obviously the required duration of anesthetic. Is it a very, very short procedure where we can potentially use just thiofentanil and azaprone in the mix, or do we need something a bit longer, something like a torphine where you get a few extra minutes? Okay, then if the animals are going into confinement for some period of time, do you need to look at something like tranquilizers? Again, these are just decisions that you need to kind of decide. And unfortunately, this isn't something that you just learn overnight. It is something that comes with years of experience. Okay. And then you need to just look at those animals themselves. You'll get to some properties where the impalas are incredibly relaxed and you can dart them very, very quickly. But then there are some properties where the impalas are incredibly wild. Potentially they've been hunted and poached, so they're very, very nervous of people, and they generally will stay quite far away from you and quite excitable. These are all just things that you need to think about. All right, so just a very, very quick kind of summary of the drugs that we can use. And I know you guys have all done your pharmacology and things like that, so you should hopefully know some of these drugs. But the potent opioids, the alpha-2 agonists, your butyrophenones, cyclohexamines, and the last one, hyaluronic acid or Hyalase. Some of you might not have heard about that one. That's just a drug that we add to the combinations above that basically increase our, or actually, should I say, decrease our induction time, so make our mobilization time a little bit quicker. Okay, so we get this a lot of questions that students ask is, what's the best combination, or what's the safest drug combination for this animal? And quite simply, it's the one that you're most comfortable with. Okay, so you can read in many textbooks various different immobilization drugs. I could probably rattle 3 or 4 different protocols per species that's kind of available at the moment. But the safest one is the one that you can predict what's going to happen, that you know how long the induction time is going to take, you know how long that animal will be safely sleeping, you know how hypoxic or hypertensive that animal is, that if you need to make any decisions or correct any problems, that you know how to do it. That's at the end of the day which the best combination would be. Okay, but as an overall rule, with the ruminants, a mixture of a potent opioid with a zaprone is fairly suitable, and there are a couple exceptions. So one that we would immediately talk about is something like an impala. They do not tolerate a zaprone as well. Again, a lot of this that I'm talking about today is more anecdotal than it's a peer-reviewed article. Just by doing thousands and thousands of these animals, this is kind of what we found. That a zaprone just drops the blood pressure too significantly in impala, and unfortunately a lot of them actually will die under immobilization with the zaprone. So just a potent opioid is okay for an impala. But then some of your other antelope, things like the spiral horns, which we mentioned a bit earlier, kudu and nyala, they will need a lot of extra drugs. So that's something like adding an alpha-2 with ketamine, preferably not an opioid alpha-2 and an azaprone combination. I'll briefly touch on that shortly. But at the end of the day, when you're working with these wild ruminants, particularly if you're going to be releasing them into a property where there are predators, you ideally would like to have a combination that is fully or at least partially antagonized, okay, by using drugs like naltrexone or atipamezole, euhimbine, something like that. You might have heard that there's a kind of newer protocols that are being suggested, and it's called the low opioid or high medetomidine combination. There's definitely a place for them, but just be very careful using them with a zaprone. Okay, so the first thing that we obviously find with this is very long induction times. And one of the biggest killers of even our large wildlife is stress, and stress that we kind of call from capture is referred to as capture myopathy. Okay, again, generally what happens is the animals, they get incredibly hot during the captures, incredibly stressed, and about a day or two after being handled, they end up dying. Okay, that capture myopathy is a complete lecture on its own. That, you know, if you guys are interested in wildlife, it's a condition that you really need to make yourself familiar with, because it is a major killer of wildlife species. Okay. Again, with this above mentioned protocol, with the zaprone, the animals became remarkably more hypoxic than what we saw in just the potent opioid and a zaprone combinations. Okay. The initial use for it was that it was just a lot safer, cheaper, should I say. But a drug like atipamezole, which you have to use now if you are going to antagonize your medetomidine, it is a very expensive drug as well. And the recovery is much longer than if you are using just a potent opioid. So just be careful. If you guys do get one of the textbooks for wildlife capture, you might see this as an option. And it's not always explained very well, some of the risks of the different protocols. So it's important to make yourself familiar with these protocols. All right, moving on to kind of just some of our basic monitoring that we can use. So the thing that I'll always say as soon as I get to an animal is ABCD PIT. Okay, so that's just to help you kind of with your thinking. As you arrive at an animal, the first thing that you need to make sure is the airway patent. Okay, and that's mainly looking at your nostrils or mouth in some species, but generally we want to make sure that the nostrils are open. Okay, so obviously obvious things like water and very, very thick bush. If an animal goes up and pushes its nostrils, or obviously if it's in the water, that airway is not patent, that animal cannot breathe. Okay, so you need to address that very quickly. Make sure that the nostrils are open. The next thing you want to assess is breathing. Okay, is that animal breathing at the rate that you would expect, or that the rate that is safe for that animal? Okay, getting to an animal that will show just now panting is not a good sign. Even though it looks like even though it is breathing, it means that it could be hot, stressed, any of those kind of things. Okay, whilst we're on the bee, that is when we apply the blindfold as well. And just like Dr. Corin said, that's just to reduce as much stimulation as possible. Okay, particularly if that animal is not sleeping as well as you want, and it does stand up, at least it can't see you, and you can then either administer more top-up drugs or maneuver that animal into a position that is workable. Okay. Next thing would be circulation, and this obviously refers more to your cardio system. So that would be things like assessing the pulse rate, if at all possible. And if you do have any fancy monitoring equipment, which obviously is very, very rare, but it would be the blood pressure of the animal, and basically applying any of your basic cardiovascular monitoring systems. Okay. The D, get the dart out as quick as you can. That's one of the things that a lot of people end up forgetting, and then you wake up your animal and you see it runs off with the dart still in. So make that part of the initial things. When you get to the animal, remove the dart. Okay. Then from the pit point of view, KP, like we say, is posture, very, very important. Get that animal into the correct posture. Okay, don't worry too much about the rhino there. That's another lecture altogether, but you'll see that eland in the top. That is kind of how we are wanting those animals. So you can see internal recumbency. Obviously, that neck probably could be a little bit higher, but at least the nose is facing down in case of any regurgitation. Okay, then as the veterinarian, you now have this animal in your hands. You have an opportunity to do some assessments for yourself. Okay, quickly have a look. Are there any injuries that need to be treated before this animal is loaded, or the rest of the procedure continues? Because if that is going to take a bit of time, you need to start obviously treating those injuries as quick as you can. And the last thing is going to be the temperature. So in some of the ruminants, particularly like impalas, temperature does play quite a big role. Obviously, if you are working on mass and there's hundreds and thousands of sleeping impalas, then it becomes a bit difficult. But as the day gets hotter and hotter, it's worth starting to do a bit more checking of the temperature of those animals. We have a bit of a rule: as soon as the first animal goes over 40 degrees Celsius, we will then cancel work for the day. Okay, that's just our protocol. It's not for everyone. Some people prefer to stop way earlier, and some people are prepared to go a bit more. But as soon as we start seeing those animals body temperatures going above 40, that's when we will then call it for the day and continue tomorrow. All right, we're going to touch on to some complications now of darting. Okay, so I'm not going to speak too much about this kudu, but what I do want you to notice just is how much blood obviously is coming out of that dart site. Okay, and then with this tessaby, you can just obviously see that this animal is in a reasonable posture, and there obviously is quite a bit more monitoring going on this animal. But the biggest thing that I want you to take home here is that blindfold. Okay, whilst that blindfold is on, that animal's is the how do I say, sorry, the eyesight and things like that, obviously the stimulation is greatly reduced, that it's not going to panic as much. Okay, again, these are only immobilizations. These aren't GAs. Okay, so these animals are still capable of having slight arousals and can actually cause some damage to you working with them. All right, so back to that picture of the kudu. Okay, so let's say that's 15-20 minutes after the dart in, and the animal is still running around and not sleeping as you should. These are things that you just need to understand of why there might be no reaction after darting these ruminants. Okay, first one is a dart failure. Okay, that's incredibly unlucky, and it does happen, an issue at manufacturing. Generally what happens is either the primer doesn't work, or if it's a Dan inject or something like that, potentially there's actually a problem in the plastic itself. Okay, the second one is skin blocks. Okay, in your smaller antelope, things like these inyalas here, it's pretty rare, but in some of the bigger ruminants and the bigger wildlife species, things like elephants, giraffe, even buffalo to a point, the skin actually will block that needle, okay, when it punctures through into the skin and into the muscles. That doesn't allow the drug to inject and go into the body, okay. It actually just it stays in the dart. It obviously does make it quite dangerous. When you remove that dart, it can actually spray, okay. So never look at the dart when you're pulling it out of an animal. Always look to the side, just so if there's any spray, it just hits the side or back of your head rather than in your eyes. And obviously that's another story altogether, okay. Intra or subcutaneous injections, okay. So obviously most of our drugs that we administer via darting, they are for intramuscular use, okay. And if it does go subcutaneous, it can take significantly longer for that animal to fall asleep, okay. Just obviously the absorption is much slower. The other option that we spoke about a bit earlier with that impala skeleton is it hits bone, okay. If it goes into the cortex of the bone, again, it's more like a plug and nothing happens. But if it does go into the medulla and it does inject, you can actually get quite a rapid downtime, but that is certainly not something to aim for. Okay, once you hit bone, you're opening yourself up to problems down the line, generally along the lines of septicemia. Okay, these darts are not clean that we put into these animals, and you are injecting bacteria when you are darting these animals. Okay, so it's certainly not a goal to hit a bone in an animal. Okay. Occasionally what you'll do is if you're trying to aim for a shoulder shot in some of the larger antelope, and as you're about to dart, they flick the ear and you actually end up darting through the ear, and all you're basically doing is putting the needle in and out, and that medication is all sprayed behind the ear. None of it actually goes into the animal. Okay, it's essentially just a piercing of an ear, nothing more than that. Okay. I think this is something that hopefully when we're young, it won't happen too often, but as we get older, something we must just be careful of is actually you put the wrong drugs in the dart. So you actually accidentally put in an antagonist or just the wrong combination completely. Okay. Often this can happen if you're trying to reuse darts and you don't clean them correctly, and you have some naltrexone, let's say, left in, and then you try to put an opioid in. When you inject that animal, they literally just antagonize the opioid that you're using, and so it won't work. Okay. The dart not pressurized, that's mainly aimed at the Dan injects. For those of you who have used Dan injects, you need to self-pressurize them. If you don't, obviously that dart will not work. Okay. Be very careful. Sometimes there's a problem with your gun and you need to actually make sure that the dart has left that barrel. Sometimes you think it has and it really hasn't. And something that can happen more often than you'd like, particularly when you are darting the ruminants, which are generally gregarious and herd animals, you actually just watching the wrong animal, and the darted animal is either already asleep or it's disappeared. Okay. And sometimes, as humans, we all make mistakes and we potentially miss our animal. Just need to own up to that, and it happens. We all miss darts. The other problem that you can get is you actually hit those animals too hard with the darts and they can explode. Okay. And all that you then have is an animal that doesn't sleep but has a massive hematoma from where you tried to dart that animal. Okay. So now moving on to, let's say the dart has worked, and now we can move on to some of just our basic monitoring methods. Okay. So some of the very basics that you can do in the field without any equipment, okay, would be pulse palpation. Okay. With the ruminants, this is all very difficult things to teach over a PowerPoint. These are things that we actually need to do practically. Okay, so it's much easier to have a sleeping buffalo or to have a sleeping impala and show you where we can palpate. But pulse palpation is something that you obviously want to be able to feel. Okay, you want to be able to observe the respiration and feel that breath, how much air is actually moving in and out of those animals. The mucous membranes, okay, that's obviously a really useful tool as well. And then reflexes. Okay, so that's something that we generally will use reflexes around the eye and panicculus. That'll give you some assessment as to how deep those animals are. Again, it's going to be far easier to do this in a practical at some point than trying to teach you in 35 minutes. And then muscle relaxation. Okay, so that's obviously more important with some of the drugs that give you more muscle relaxation, things like medetomidine. If that animal is still quite stiff and rigid, obviously you can assume that some of your medetomidine or some of that alpha-2 actually hasn't worked. Potentially need to consider a top-up. All right, then your instruments that you can take. So we always have a rule, as long as you have a stethoscope and your thermometer, you can already do quite a lot. Okay, so obviously for all your auscultations, obviously the bigger the animal, the harder auscultating becomes. Okay, it's very, very difficult to hear breathing in or to get good lung sounds from elephants and rhinos and giraffe. Not impossible, but it's just a lot harder. But for the smaller antelope, it's an absolute necessity. If you have a pulse ox with you, that's always very useful. You can just apply it to the tongue of most of these ruminants, and it will give you some kind of status of the oxygenation of that animal. Okay, if you are lucky and you have capnography, that's again, these are just very, very specialized tools that we can use. And then thermometer. Okay, that's an absolute critical piece of equipment that you need. Okay, there's obviously a lot more that you can take. I'll show you a bit later in the elephant slideshow. There are other tools that we can use as well, but not always practical for working in the field. Okay. For the pulse palpation, some of the most important things that you're trying to feel, things like pulse rate and the pulse rhythm and your vessel tone. Okay. Again, to say the most important thing is to realize what's normal so that you can then learn what's abnormal. Okay. It's going to be very, very similar with the ruminants. You can withdraw from your knowledge of some of your general livestock principles, things like your cattle and your small stock, goats and sheep. Most of those principles will apply to your ruminant species, apart from, let's say, something like the giraffe. Okay, they're slightly different. So a lot of that you can extrapolate for your wild ruminants. Okay. For where to palpate, okay, the femoral is probably your best, the femoral artery. It's probably one of the strongest ones. You also have a dorsal pedal artery. That's probably the most accessible, though, when the animals are in the posture that we want them, or in the position that we want them. Okay, the pulse obviously should be full and regular and strong. Okay, if you start feeling a weak pulse, or there's it's an irregular rhythm, you obviously know that there is something wrong, and you need to start considering what interventions you might need to do. And bear in mind, the quickest and safest intervention that you could do is actually just to wake that animal up if you are concerned about it at all. Okay. Yeah, let's skip on to the next one. Okay, so like we said here, okay, very, very difficult to do any kind of monitoring on these patients in the field. But as long as you have a stethoscope, thermometer, and obviously your eyes and your experience, then you can do actually quite a reasonable amount of monitoring before any problems arise. Okay, so I hope this video works. Okay, but this is a giraffe. Okay, and let's say you just arrive with this giraffe and it's breathing like that. Okay, this is before even most of your other equipment needs to be established. There's a problem here. Okay, this giraffe is hyperventilating. Okay, so it could be because it's very hot, might be because it's very stressed. You need to consider what has happened in this case, but this is certainly not a safe situation for a giraffe to be in. Okay. With the pulse oximetry, if you can get your hands on one, it certainly is very, very useful. It basically allows us to detect how hypoxic that animal is. It does have limitations. I'm not going to get into the limitations now. This is just meant to give you basically an overall indication of the oxygenation of this animal. Okay. If you do see the oxygen level or the SpO2 on these pulse oxes go low, then I would certainly consider supplementing oxygen at the very least. Okay, that's the bare minimum that you can use. Okay, obviously with different species, okay, we might be going across, so you can see the carnivores and a buffalo and an elephant. There's different ways that you can apply these pulse oximetry or the pulse oxes onto these animals. Again, it's mainly just experience as to where is going to be the best place to put on these pulse oxes. Okay. If you do get very, very low readings, okay, so I would say don't just panic straight away. The first thing is to just make sure that pulse ox is placed correctly. If it is placed correctly and you're absolutely convinced about that, then you need to consider what is going on physiologically. Okay, is there massive vasoconstriction, which could be drug induced? Is that animal very hypoxic? Again, generally drug induced. Something like methemoglobinemia, normal anemia, and severe hypertension can also cause those readings to go very low. Okay, so it does have limitations, but at least it does give you a clue as to something that's going on physiologically. In the event that you don't have a pulse ox machine, there is a very, very nice quick tool, and that is to actually just take an arterial blood sample. All you need is a needle and syringe, and you then can look at the color of your blood. Okay, and this does come with experience. Okay, so if we look at the kind of the animal in the middle there, which had thiophentanil and medetomidine, you can see the blood samples more on the left-hand side are quite dark. Then you can see that atipamezole was administered, and you can see how much richer that red becomes. It's that basically an indication of much better oxygenation. So if you don't have your pulse ox with you, you can easily just take an arterial blood sample, and this does give a good indication of the arterial blood oxygenation levels. But very important, you need to do this a lot initially with the use of, let's say, like a blood gas analysis, that you can actually then start predicting the color of the blood and what its reading would be if you were so lucky to have the correct monitoring equipment. Okay, so you're obviously wanting to aim for something more on the right hand side where it's very nice, rich, and oxygenated. Okay, and here's just basically an overall perfect picture of a ruminant that is lying with all of its monitoring equipment if it's available to you, but the positioning is really good. Okay, so it's obviously in sternal, neck up, nose down, and there's going to be no problems with the stable antelope. Okay, we've spoken a bit about the blindfolds already. Okay, it does calm those animals down. Okay, if they are a bit twitchy when you get to them and you apply a blindfold, you'll see that they will immediately become a lot calmer. Okay. Bear in mind, as with a lot of these immobilizations, those animals' eyes actually stay open. Okay, so if you do not put a blindfold on, there can be damage, okay, from the amount of light that's going in, okay, the ultraviolet in particular. So that is also why we apply the blindfold, is actually to protect the eyes. We say that also to reduce drying, that should be in connection with actually using artificial tears or just lubricating those eyes. Okay, obviously they can get dry from these immobilization. And then obviously we're working out in the field. You can obviously, these animals are falling over in the dirt, and we don't want to get the dirt in those eyes. Otherwise we're opening ourselves up to corneal ulcers and further problems. Okay. The very, very important thing that you need to be careful of with blindfolds, and I've seen it time and time again, is people putting the blindfolds on that actually blocks the nostrils. And obviously, if we go back to our ABCD pit, the first thing is to make sure that airway is patent. Do not go ahead and block those the nostrils yourself by putting on a blindfold. Okay. Like I said earlier, again, we've got an opportunity when these animals are immobilized to actually just assess for injuries and the general condition. So this is just a very quick thing. You'll obviously be, you will have access to these slideshows as well. So I'm not going to spend too much time on these now, so we can get moving on to the important things. But obviously just go through do a clinical assessment, because you cannot do a preclinical assessment, unfortunately, on these large wild animals. As much as we would like to, when you put that dart into that animal, you actually don't know what health status it is from afar. Okay. This I'm going to kind of go through pretty quickly, okay, so we can get to the end and have a bit of a Q&A on the ruminants. Okay, again, like I say, you're going to have all of this available to you. But for buffalo, very, very easy. They're not a complicated immobilization. An opioid and a zaprone works very, very well. In that slideshow that I did mention, there will be suggestions that you can move across to a low opioid and a high medetomidine. Absolutely fine. If it's a safe area to work, just be very careful of adding a zaprone into that combination. Okay, that's where we've seen problems. Okay, the tranquilizers. Okay, this is something that's more if you're going to be doing transport or keeping these animals in confinement for a while. Again, I'm not going to go into the different amounts of dosages. You will have these tables, and there's plenty of these in literature. But the drugs that we use are zaparone, acufase, or zuclopenthixol, and water-based perfenazine are some of the most commonly used ones at the moment. The biggest difference between these is the length of action. So a drug like zaparone is a couple hours. Okay, generally we see by about 8 hours at the absolute max that the zaprone is completely out the system. But for when we're busy doing transport, we can actually top up those animals with a zaprone every 2 to 4 hours at least. Okay. Drug like acufase or zuclopenthixol, that's a much longer acting. We call it about 5 days or so. So that's if you are going to be confining these animals for some time. And water-based perfenazine, 3 to 5 days at an absolute maximum. What's the biggest advantage between the water-based perfenazine and the older oil-based perfenazine that you might have seen or heard of is that you don't get any of the extra pyramidal effects with the water-based perfenazine. So that's going to be things like stargazing and fly biting that sometimes these ruminants have when they're overdosed. Basically, they're not really with it. Water-based perfenazine is quite a safe drug to use for long-term tranquilizer. Okay, blue wildebeest, it's another antelope, or sorry, should I say another alcephaline? That's very good with the opioids and azaprone. Again, please, you can read this up yourself. If there's a species that just requires something a little bit extra, I will mention. I think the one thing about blue wildebeest that needs to be known is they can be incredibly dangerous. Okay, I think everyone knows how dangerous buffalo can be, but blue wildebeest have been known to attack people as well, particularly when cornered. Okay. Okay, sable and roan antelope, they can be slightly different and slightly trickier than the first two species that we've dealt with. Okay, the biggest issue that we see with them is the amount of drugs that they take to get immobilized, and also during the immobilization, once you have your hands on them, they're very prone to kicking and muscle rigidity. Okay, so what we end up doing is actually adding ketamine into the mix, and that's just to try and get them in a slightly deeper plane of anesthesia than what they would be under just a general immobilization. Still not suitable for surgery, but basically we're just aiming to try and reduce the amount of kicking and movement that they have. Okay, so if any of you have worked with sable or roan, which I think in Malawi there are quite a lot of these species, it is going to be something that you will be working on if you go into wildlife. Just be careful of the amount of movement that you may get. These are species where the addition of an alpha-2 can help you, and just from a muscle relaxation point of view. If you are using medetomidine, like I said again, I'll say it again, please just do not put azaprone into that mix. Okay, impalas. Okay, these are obviously the one of the most fragile of all the antelopes, but there's a reason why there are so many of them. They are incredibly successful. They are incredibly intelligent. They are very, very hard to work with in big numbers. Okay, you might be able to get one dart into a herd, but try to get 2, 3, 4 of the same herd. They become very, very smart and very, very wise. Okay. The biggest problem that we see, though, with them is how sensitive they are to the drug combinations. So we do not use azaprone in them, like I said earlier. And as soon as we get to them, after just using a potent opioid, we use a very low dose of diprenorphine, okay, or butorphanol. So quite similar to rhinos in that sense of trying to just lift the plane of anesthesia slightly and improve the breathing. We will give them a partial reversal. Okay, they're still very manageable to work with, but it certainly improves their breathing quite significantly. Okay, waterbuck. Again, these are species similar to your roan and your sable, where just because of the size of them, it does sometimes help with adding a small amount of an alpha-2. Medetomidine is the one that we use primarily. Again, if you do use it, please just remember to leave azaprone completely out of that mix. All right, now onto some of the spiral horns. Okay, and this is where it can feel quite expensive darting these antelope, but just because of the amount of drug that you need. Okay, so you'll see in the top line that that's our most common combination that we use. It's an opioid, medetomidine, and ketamine. This is a species where you need to consider, again, if you do use azaprone in your dart with the opioid and the medetomidine, they are going to be hypoxic. So potentially, like I've said in the last point there, have some atipamezole on standby. If you are worried about very shallow breathing, you can always start giving atipamezole at low doses just intramuscularly, which will start reversing some of the medetomidine. Once that animal is down and recumbent, the amount of opioid will actually keep it recumbent. Okay. The biggest challenge we have is just getting them into that recumbency phase. These antelope in particular can run several kilometers, and they get into a bit of an excitable phase where they kind of just throw their heads back and they'll just run, and they end up running down hills towards water for quite a long time. So We also add high into the dart, and that's just an attempt to try and reduce that induction time and that excitement phase. Okay, Inyala, very, very similar, okay, to the kudus, just slightly smaller. So in terms of the combinations, and this would be for bushbuck and eland as well, very, very similar combinations, just obviously they're slightly smaller antelope, so you can come down on your doses very slightly. Okay, again, with the eland, so I know I'm feeling like I'm rushing through this. I just want to see if there's any questions, but again, you are going to have all of this information at hand for you guys from now on. All right, then the very small antelope. Okay, so things like your duiker, your dik, your klipspringer, steenbok, they are surprisingly tolerant of the opioids. Okay, the problem with them obviously is due to their small size is what darts you're going to use, and we basically just advocate the absolute smallest dart that you can get, which is basically a 0.5 mil little dart with a little 1/2-inch needle on it, and you only aim for the gluteal muscles, only on the back leg. Do not aim for the shoulder, for the neck at all. You will end up fracturing a scapula. Okay. We basically have two combinations that we like. We either use an opioid and a zaprone, but there's also the BAM combination, which is butorphanol, azapirone, and medetomidine. Okay. The big advantage with BAM, it's a very, very safe drug. Okay, or safe drug combination. We use it on obviously a lot of other species, but also you just get a lot of muscle relaxation from the medetomidine primarily. Okay, the major advantages with these little antelope, those horns, like you can see with this klipspringer on the right there, they are incredibly sharp. Okay, even with the opioid and the zaprone, there's still a degree of movement. They have unfortunately stabbed a few colleagues in their hands, and they are incredibly sharp. They will go straight through. So having that extra muscle relaxation does actually help your immobilization and does make it quite a bit safer for you and for the animal. All right. In this case, we use another drug, haloperidol, that works very, very well for the small antelope. Very, very small dose. This gives you several hours of good tranquilizer as well, whilst you're transporting them. All right. I think I hope I managed to keep into the time frame there. Are there any questions on the ruminants?
Okay, thank you so much, Dr. Chris. So I would like to ask the audience, if you have a question, please raise your virtual hand, or you can type it in the chat, then I will read it for you. I can see we have one question in the chat, and it's from Greya Mchali. And she says, hello, I have a question for Chris Smith. Could you please repeat your explanation on the Bowman confinement, time under factors influencing the dosage and choice of anesthetic?
Okay, all right. So I think that's something that we often are faced with when working with these ruminants. There's going to be a degree of confinement time, particularly if you are transporting them. So whether that's going to be in a truck or whether it's going to be in a boma. Okay, so I'll be honest, when we are darting those animals for confinement, I'm not too concerned about the drug combination I would use, whether it's a potent opioid and a zaprone, or whether it's going to be the potent opioid at a lower dose and medetomidine. Okay, but what's important is the tranquilizer. Okay, so if it's going to be, let's say, for 1 day or 2 days that you're confining those animals, just using a drug like zaprone would be acceptable. But the longer that those animals are going to be in confinement, then you want to consider one of the longer acting tranquilizers. So that might be water-based bifenazine, which will give you 3 to 5 days, or Accuphase or Zuclopenthixil is its name, and that will give you 5 days certainly. So it's more how long is that animal going to be in confinement for, and the appropriate tranquilizer that you'll use. The tranquilizer lecture, I would say that's another whole discussion. So I've very briefly touched on that now. So yeah, I think for now that explanation I've given, that will be enough. Okay, and I just see you just added to your question, what is a boma? A boma is basically a temporary holding facility. Okay, it's just a very well used name in South Africa, boma. So it's any facility that you'll use to temporarily hold an animal. It might be anything from about 20 by 20 meters to 50 by 50 meters. Okay, so it's a small area where you can easily work with the animals between capturing and loading to be transported.
All right. Thank you so much. There is another question from Yamikani. Yamikani is saying, can you please come again on the factors that influence dosage and choice of anesthesia? You talked about pregnant animals.
Okay, so essentially what happens is with the female pregnant animals, I see there's a few questions on that. Okay, those animals, obviously, particularly later into their gestation period, because of the size of the fetus, bear in mind, the opioids cross the placental barrier. Okay, and so we do see some of the drugs going across and affecting the fetus as well. So essentially, then the total amount of opioid that would be for the pregnant mother is reduced. Okay, so if we would normally give, let's say, 2 milligrams of opioid to, let's say, an Impala ewe, maybe when she's very pregnant, you would give her 2.5 milligrams. So you just go up ever so slightly. Okay, and then just on that again, why does the sex of the animal determine the amount of drug to give? Just bear in mind, with a lot of species, males are a lot bigger than the females. Okay, so it's more from a size point of view that matters.
Okay. Yeah, okay. Thank you so much, Dr. Chris. And I would like to encourage the audience to please raise your hand. Would love to hear your voice. Yeah. And there is another question from Renate. Renate is saying, for animals with injury to the ventral body, for example, the abdomen, what is the safest positioning to allow the treatment while accounting for the risk of regurgitation?
Okay, so obviously it's never a comfortable situation when you are treating something like that, but the side that you want that animal, if it has to be in lateral, you want the right on the ground. Obviously the rumen is more displaced onto the left of these ruminants. Okay, so obviously if there is going to be some bloating, what allows is that the bloat can then actually rise up on the left hand side and not push into the ground, which will then actually push that rumen forward towards the diaphragm. So if it does have to be in lateral recumbency, you put it with the right side facing down. If it's at all possible, you get a small plank of wood where you can lift the neck ever so slightly and still pull the neck down. So you still keep that same position of the neck up and the nose down to try and prevent the regurgitation.
Thank you so much, Dr. Chris. I can see we have a hand from Yamikani. Yamikani, would you please unmute and ask your question?
So, yeah, question is the pregnant animals. You said that they require more anesthetic. So these drugs can cross the placental barrier, right? So
correct.
If these drugs cross the barriers, won't that have a negative effect on the fetuses, like neurotoxicity, since the rivers are underdeveloped in the fetus?
Very good question. So no, we with something like the opioids, we don't see any negative effect of them. You just need to bear in mind that with a lot of these drugs, there's going to be a depression of certain metabolic activities. Okay, generally, as or with this with the time frame of these immobilizations, okay, it's aimed to be very short. Okay. And so when you do administer the antagonist, it antagonizes the entire body, including the fetus. So naltrexone will antagonize the potent opioids across the whole body, including within or across the placental barrier. The drug that you need to use very cautiously, I'll be honest, is the alpha 2s, particularly in early stages of pregnancy. You can get abortions from that, and we've seen that quite several times. Okay, so particularly in the first month or two of being pregnant, if you do use an alpha 2 like medetomidine, we have seen abortions take place. So in that case, if you are concerned about the pregnancy status of the animal, my preference would be to use a straight potent opioid and a zaprone, because that is yes, you can't reverse the zaprone, but it's only a tranquilizer, but you can completely reverse the potent opioid, and that animal then will almost be fully awake. Okay, so it's about choosing a drug combination that, if there are any problems or that you are concerned in any way, that you can fully antagonize.
Thank you so much, Chris. There is also another question from Clara. Clara says, thank you so much for your talk. Are there any drugs you wouldn't use on compromised animals? How compromised would they have to be?
All right. Again, when selecting your drugs, okay, and talking about how compromised they would be. So I would very much stay away from your alpha-2 antagonists in ruminants. Okay, in your carnivores and things, it's a different story. But in ruminants, they're very, very sensitive to the alpha-2. So I would not use any of the alpha-2s. I would use a low dose potent opioid with azaprone. Again, like we said, now the reason why I would want a potent opioid, it's because I have drugs like naltrexone that I can completely reverse that animal very, very quickly and get it to wake up. Again, for me, I use potent opioids every single day of my career, and so it's the drugs that I understand well and know how I need to correct any problems that we may experience.
Thank you so much. That was a good question. There is another question from Patience Baralika. Patience is asking, does asepsis not matter in the world, considering most of the procedures are done in the field and the asepsis is one of the general principles for surgery?
I think you are 100% correct that very, very little is done clean, let's say, when we're working in the field. So again, for the general principles of surgery, bear in mind, like I say, these are the mobilizations we're talking about now are not aimed at doing surgery. Okay, so this is for simple relocations, very simple procedures. There's going to be very little cutting into the animals. Okay, so you're quite right. Asepsis is a problem. Okay. The aseptic problem that I want to quickly just mention on this is the darts. Okay, so when you buy your drugs from the companies, those drugs that come in these little vials, those are completely sterile, completely clean. They've obviously had to go through rigorous registration processes. There's no problem with that drug. The problem is the darts that we get, they are non-sterile. They are, I don't want to say necessarily aseptic, but they are non-sterile. Okay, so they have not gone through a sterilization procedure. So you're taking now a very sterile medication, you're putting it into a dart, and now you're putting it into the animal. And so yes, there is a risk of introducing a bacterial infection. So what we do advocate is you just treat the dart site. Okay, so you can use a very short-acting antibiotic, something like a penicillin, right at the dart site, and that is all the treatment that animal will require.
Thank you so much. I'm really enjoying the good questions from the students. Well done, students, and keep it up. I can see we have another question from Renate. Renate is asking, how common is the use of IV catheters for intravenous drugs or administrations of fluid in immobilization procedures? And what would be the optimal placement?
Okay, so I think the first thing that just to kind of talk about the wild species and the ruminants. So when it comes to we're kind of going a bit onto treatments now, which again it's a very long and interesting discussion. But the biggest thing that we have is in free ranging wild species is when do we intervene from a veterinary point of view? Okay, so the first thing, just to clarify, if you're in a free ranging reserve, it would be considered wrong to, let's say, try and go and help a buffalo that's got a wound on its side. Okay, that's natural. Okay, so the only time that we intervene obviously would be if it's a man-made or man-caused problem. So a snaring, a poaching incident, hit by a car, something like that. Otherwise, if it's a natural injury, we do not intervene at all. Okay, that's our nature is, and the weaker animals obviously get taken out by the predators. So our treatments, and let's say like when we placing catheters and things like that, it's very, very limited in the ruminants. Okay, things like rhinos and carnivores, completely different story. Okay, but if you are wanting to place an IV line for either whether it's drugs or if you want to do fluids, just bear in mind the bigger the species, the less useful fluids become because of the amount of fluids that you actually need to get in it. It almost becomes not worth it. You need liters and liters and liters to make any difference of to the fluid status of these animals. Okay, but if you're wanting to use an IV catheter in one of the ruminants, the ear is going to be your easiest point of access. Okay, so any of the auricular veins are quite easy. The reason is because of the positioning. Okay, so yes, there are cephalic and saphenous veins that you can aim for, but obviously when they are insternal, those veins become a little bit harder to get. So we normally just say go for the ear veins if you are wanting to put a catheter in. When it comes to if you are wanting to give any intravenous drugs and things like that, in a lot of these ruminants, particularly because of their positioning, the jugular is a very, very good option to be able to give drugs in as well. Obviously, they're quite big as well, particularly in things like buffalo and kudus and inyala. So the jugular is a very good venous option for the drugs and catheter I would put into the ear.
Okay, thank you so much. There is another question from Dr. King Chidakwa from Zambia. He's asking, first of all, he says, thank you so much for the good presentation. And now he's asking, would you kindly explain the dangers of immobilization drug opioids going into IV, and what would be the signs?
Okay, so I think what's important with the opioids. Okay, so the I'd say one of the biggest issues that we have from them is obviously respiratory depression. Okay, the respiratory depression then leads to hypoxia. However, that being said, you can actually give some of these potent opioids IV if there is an animal that requires a top up. So let's say you're working with an elephant. We'll speak about the elephants now. But if an elephant starts waking up, you would absolutely consider giving its opioids intravenously. That then essentially gives you a much quicker. It works much quicker. Let's leave it like that. However, that being said, if you dart an animal and you accidentally hit a vein, however that might be, the first thing that you are going to see will be the induction time will be incredibly short. Okay, so if you're expecting a 3-4 minute induction time and you actually get a vein, it's going to be 30 seconds to a minute. Then you know that you've probably got some of that drug into the vein. The dangers of it though is just how quick the respiratory depression can set in. So if that's the case, if you're working with the potent opioids, always have butorphanol, always have diprenorphine, and always have naltrexone quickly at your side. If that animal is breathing but very, very slowly, so let's say the respiratory depression is down to like 1 or 2 breaths per minute, consider giving butorphanol intravenously to see if you can actually just pick up that respiratory rate. But the best thing to do is if you're worried in any way that, let's say, the breathing stopped, but there's still a heartbeat, give that animal naltrexone, wake it up, and go for another animal.